right, so we can go ahead and get started. So hello everybody, and welcome to another webinar hosted by Mariner Wealth Advisors. My name is Jude Grimaldi, and I'm one of the members of Mariner's practice management team here, and I will be your host this afternoon. So today's webinar is all about strategies for your Medicare journey. Now, when I work with advisors and clients, this is definitely one of those topics that not many people seem to know much about, or they don't really necessarily know where to go for these resources other than to their advisor. So we're really hoping that today's session is as helpful as ever in educating you on some of the options that you have when it does come to Medicare. Now, as I mentioned, my name is Jude Grimaldi, and I'm joined today by Joanne Giardini-Russell. Joanne is a self-proclaimed Medicare nerd, and she is the CEO of Giardini Medicare. Joanne and her team work specifically within the Medicare space, and she will be our presenter today. You know, she has some really, really great content and some really great resources for you all, so I'm confident that you'll leave this session with some golden nuggets, if you will, from Joanne. So just a couple of housekeeping items. So we do want this session to be engaging. So if you do have any questions or any comments, definitely feel free to shoot those inside of the Q&A or the chat feature that you're going to see on your screen here. Now, then we're going to pass things over to Joanne in just a second, and then we'll go ahead and get to some of the questions at the end. And then finally, we will leave you all with a few of the resources that we have available for you. So without further ado, I will go ahead and kick things off to Joanne.
Thank you, Jude. I'm going to try and share. There we go. Got it. Great. Thanks, everybody. Late in the day, there's nothing more exciting than Medicare. I'm sure you're all thinking that right now. This is it's kind of a lot of content, and I'm just going to kind of forewarn you too. I do speak quickly. I think it's just the Italian in me coming out, but there's a lot there. So please, take notes. You'll get my email address at the end. People email constant questions, things like that. We're totally good with that. I hope it's a broad enough overview that you're really going to get some direction out of this too, but then you're just going to see a lot of what goes into Medicare, because as Jude said, it is confusing. Everybody out there is just as confused as you are, so we're going to start right in. I always want to point out too that I have an agency. We're based in Michigan, and people always ask this question because we get to the end of the presentation. They're like, well, how do you get paid and what's your involvement? So we are paid. We are insurance agents at the end of the day. Okay. So I have an agency. We're paid just like your home and auto insurance people are. People don't know that Medicare agents exclusively exist. I will tell you that we exist. We sure do. And all we do is we help people get to Medicare properly. And I'll kind of walk you through this stuff, but that is how we get paid. Okay. So there's no payment between Mariner and myself. We don't share any of that kind of stuff. We value partnerships like this and just, getting that good content out there. So 4.2 million people are turning 65 this year. So if you're one of those, there's a good chance somebody out there listening right now is. There's a lot, okay? And they are just literally as confused as you are. And you'll understand when we get to the end of this stuff that you may enroll in Medicare this year, you may not. You may not need to, contrary to kind of what people are telling you. We're going to talk about all of the confusion that kind of goes into Medicare. So at the heart of what we do, unfortunately, chaos is really the foundation of it. And it's unfortunate. My own husband turned 65 last fall. This stuff hits your mailbox. It's your robocalls. It's everything. It's designed to be confusing. All right. So just understand, I hate to say it, but you're a target to lots of these mailers. Everybody is selling your data. Unfortunately, you'd be horrified to see how I could show you that on Google Maps. Essentially, we can show you as agents how to see who's turning 65 within a 10-mile radius of my house right now. It's crazy, but there's a lot that goes into it. Again, I think it's designed to be confusing. You've got this garbage on TV. You've all seen Joe Namath. You've seen JJ Walker. You've seen all these plans that are advertising that everything is free. You start to feel like you're the only human on the planet that pays for your medical coverage potentially. So it's designed to, get you to make phone calls. All right. And those call centers are just, they're ruthless kind of these days. So people always wonder, how do you start learning about Medicare, right? So one great place to start is webinars like this. The Mariner's providing information. You can go online yourself. You can go to Medicare.gov. Medicare.gov, I'll just tell you, is a great source of information, but it's really good for us, for agents, okay? Because we know what we're looking for in there. It's kind of like a giant encyclopedia. We're in there all day long looking at drug plans or things like that. But for you, you just don't know what to put in the search bar. So it makes it kind of tough. I'll also tell you with Medicare.gov, a lot of people go there to find the certain plans that might be in your state or your area. That information is often wrong, all right? So Medicare.gov is really good for some stuff, and it's really not so great for other things. So you got to be careful on how you learn this stuff. I'll tell you at the end, we kind of talk through it too. I think YouTube and webinars are probably one of the best ways to learn Medicare, because there's a lot of, we have agency colleagues around the country, some with great YouTube channels. We've got a YouTube channel, but it's a really good way to learn and kind of do it privately, take your notes, compare notes, you know, call a couple agents, things like that. So just some tips there. Medicare has a lot of bad information out there, and this is one piece or an example of poor information, if you will. This came out a couple years ago from Costco magazine. I keep it in here always because it just shows that Costco, again, is not the end-all be-all to Medicare information, but they do produce this content that really confuses people. And I actually went to the editor in this case, and I said, this is actually wrong. So that upper box on the right, it says that first you need to enroll into Medicare when you're first eligible. Well, for most people, that means age 65. So if you read that, and Costco's telling you you have to go do that, and if you don't do that, you will get a lifetime penalty for Part B, that's incorrect, okay? So I wrote the editor, and I said, this is wrong. And he said, well, that's crazy because we fact checked it with Medicare.gov. And they couldn't have, because that is not on Medicare.gov. So you've got to be really careful when you read stuff like this, because if you're talking to a friend that just read the same article, you both agree that it's factual because you both read it in the Costco magazine that week, okay? So Medicare is much like that game of telephone where you tell one person, then the next person, and all of a sudden you get totally different results at the end. So you got to be really careful of where you're getting information from. So it's very, very hard. We focus, our agency here in Michigan, we focus on helping people transition to the Medicare space. And what I mean when I say that is people that are typically age 65, you know, they're looking at Medicare, do I need to do this? What do I have to do? That kind of thing. Maybe you're 68 and you're just starting Medicare because maybe you didn't need it at 65 years old, or maybe you do need it at 65 years old. Or I had a call this afternoon where he's 63, he's on disability. He's just being given Medicare. So he needs Medicare, but he's only 63. So that's what we do, is we transition people to the Medicare system properly, because our job is really about trying to stop and fix mistakes before they happen. With Medicare, and you're going to see some of these mistakes that you can make that we can't fix. So if you do things wrong with Medicare, some of this is not fixable. So you can't just call a Medicare person and say, hey, I want to change X, Y, and Z, because some of it, like I said, is just impossible. So we really want to just do things right from the get-go. So we spend all of our time talking about these things. Medicare, what it is, do I need it? And that's really a huge thing to really get people to ask, do you need it? Don't just go sign up for Medicare just because somebody told you you had to go get it. Know why you're doing it, okay? So some of it you'll understand as I talk through these. If you do need it, how do you go get it, right? And people just say, go sign up for Medicare. Well, what does that mean? Do you go to an office? Do you go online? Do you make a phone call? That kind of stuff. These seem like silly questions sometimes, but they're really not. How much is it going to cost? And we're going to cover these things today. What is it going to look like when you put all those things together? You know, what is reality of living with that one plan you picked versus the other plan? But ultimately, we want to get you to the end of this where you can just go relax and you have, you know, happy retirement. You work with your planners going forward. You know, there shouldn't be a lot to it. When you get to Medicare for the first time is when you really have to kind of understand and make some big decisions. So what is Medicare? Medicare is just insurance, okay? And I say just insurance in a way that I hope it just alleviates any stress, because yes, it's insurance provided by the government, sold by the government to you if you need it, but just understand that it's just insurance, okay? It's really no different than buying Blue Cross or Aetna or United Healthcare, something like that. And when I say it's the same as those other carriers, it's not designed to pay 100% of your healthcare cost, just like your current insurance is not. Your group insurance is not designed like that. Neither is Medicare. Okay, Medicare is designed to be used in the United States. All right, it's not designed to be taken to Spain and go work there for 6 months and go have your insurance for routine things. Okay, it's just, again, just like your current insurance. Now, who's eligible for this Medicare stuff is people when they turn 65 or they're older, or disability, like I just said, a 63-year-old on disability. He's gotten 2 years of disability income checks, and now he's being awarded Medicare. You've also got a couple medical conditions that are also where people are fast-tracked over to the Medicare system. That would be end-stage renal disease and ALS, okay? But today we're gonna really pretty much stick to 65 and older unless there's any specific questions at the end. What you get with Medicare. So when you're enrolling into Medicare, you've got two parts to the system. You've got Part A and Part B. Many of you already know this, but I'll be recapping some of this. So Part A is hospital insurance. It's hospital coverage. If you are hospitalized overnight as an inpatient, this is when it's gonna kick in, okay? It's also gonna come into play if you're in a skilled nursing facility. Also, it'll come into play if you're under hospice care, all right? But you can see that there's deductibles, there's co-insurance, things like that. I'm not really gonna go into many of those because most of the time you're gonna be working with an agent like us that will give you a product that'll cover those deductibles and co-insurance requirements. So you're really not gonna see those unless you have original Medicare and that's all you have. Now, the other part to Medicare is Part B as in boy. And then this part is what you're really used to with medical insurance. This is your CAT scans, your MRIs, your chemotherapy, your wheelchairs, all that kind of stuff that you would think of maybe as your Blue Cross plan that you're buying today or your work insurance plan, things like that. Now, Part B, this is an important number, is the deductible for Part B. Currently, it's $233. So you're gonna see that number come in as we talk about products in a little bit. But that's an important number to pay attention to. And you can see that everything else is a 20% co-insurance. And you're gonna pay those things if you don't have any product in place. But most people, like I said, are going to get a product, okay? If you have just A and B, you really, really, really should have another product to kind of cap your financial situation in that case. There are premiums. Now, Part A typically has no premium. 99% of people at least don't pay any premium with Part A. It's been prepaid. So even though if you look back at your pay stubs for 30, 40 years, there's that little M care box in your pay stub. That's for Medicare Part A. So you've actually prepaid a good chunk of premium there. So they're not going to charge you further premium, but there is a premium to Part B as in boy. I'll have a better list coming up about the cost, but the base level is $170.10 this year. Okay, there are 6 levels, but in this case, we're just talking about the 170. So just know that there's a premium attached to that. I always want to point out with Part A, so a lot of people see that skilled nursing, they think that nursing homes are covered in terms of Medicare. They're not, okay? So please be cognizant of this. We do not sell long-term care insurance. We just constantly tell people that Part A is not going to cover long-term care. You go talk to your Mariner advisor, talk about long-term care. How is it going to be handled? Because a lot of people, very statistically high amount of people need coverage for long-term care expenses or custodial care, and neither will be covered with Medicare. Okay, so it's just really a big deal to get that across to you. Second big deal to get across is that between A and B, if you have those straight A and B of Medicare, 80% coverage is what you have. All right, you do not have 100%. And that 20% that is open, there is no cap to that. So I recall a woman a couple of years ago had a knee replacement done. She paid $12,000 for a simple knee replacement because she only had Part A and Part B. And again, think that's a knee replacement. Think if it were cancer or something like that. You can have some very large bills if you only have Medicare A and B. So remember that. Again, agents can typically come in and give you a product that's going to cover the 20%, but that's what we'll work our way up to as we talk through this. Now, original Medicare is not going to cover a fair amount of things. It's not going to cover a lot of things that people are kind of used to. One being dental. You're used to having dental insurance through work or buying it yourself, but original Medicare is not going to cover that. And again, when I'm talking about original Medicare here, I'm talking about Part A and Part B. So there is no dental coverage. That is a huge sticking point with lots and lots of people that are on Medicare. Lots and lots and lots. They tried last year, the government did, to actually put Medicare into, or put dental into Medicare. It didn't happen. I don't see it happening for quite a while, if ever, but prepare yourself for some large dental expenses. Every single day we're hearing from people with implants or crowns or root canals. They need $5,000 for this, $6,000 for that, $3,000 for that. It's more expensive than you think, okay? So plan for that, unfortunately. And then routine vision exams are not going to be covered through Medicare either. So that means if you need an eye exam or if you need glasses or contacts, things like that, not covered, okay? Glaucoma. cataract screenings and surgery and detached retinas, things like that, those will be covered. Okay, so I want to make a big distinction there. If it's medical, it's going to go under your medical. But if it's just an eye exam at Costco, it's not going to be paid for by Medicare. Same kind of goes with hearing. So hearing testing can sometimes be covered with Medicare. They're not going to pay for hearing aids. So again, you're looking at $5,000 to $7,000 to $8,000 to $10,000 for hearing aids. Gym memberships are not included in original Medicare, and then prescription drugs are not included in original Medicare. Now, just because they're not included doesn't mean there's not ways to get coverage for all of these things, okay? So there are carriers that might give gym memberships. There are carriers that offer some dental plans. There are standalone dental vision hearing plans, things like that. And then we have separate plan Part D for separate prescription medication. So we always, just as agents, and what I do is we just kind of, in poking fun and jest a little bit, but I'm serious about where you're going to for advice. Your friends and family, they may be well-intentioned, but please take it with a grain of salt. What they're telling you, everyone tells you that they're paying nothing for everything. They're getting all sorts of stuff for free. Again, you kind of feel like you're the only dummy on the planet paying for healthcare, but they're forgetting either co-pays or things like that. So, and a lot of family members will just tell you, you have to do this because maybe that was appropriate for them. It's not for you. So everybody's really different. Social Security, just understand that they're not Medicare. So you have to enroll through Social Security, but a lot of times when you call their office, you get bad information. We had somebody not too long ago that was mad because Social Security didn't tell her to go buy a drug plan. They don't care if you buy a drug plan or not, okay? So just make sure you understand the roles of each of these places. Your doctor, we have lots of clients that are doctors. Doctors do not understand Medicare because it's insurance. It's not medical practice, right? It's not part of that. They don't know. The financial planners, this is exactly why a Mariner pulls us in to talk about this, because they're not sitting there doing Medicare 12 hours a day like we are. So there are people that specialize in Medicare. So be careful in who you're going to for advice. But there's a lot to it. So when we're talking every day to people, we're trying to understand, number one, you're eligible for Medicare, but then we have to try and figure out, okay, now that you're eligible for it, does that mean you have to go do it? So remember number two, when I said, do you need Medicare? That's a really, really big question. So big that we're going to have a whole webinar based on that, because this is just a sampling. So today what I'm showing you is just a sampling of a couple things. We have to start with, are you eligible for retiree coverage? I talked to someone today who was a retiree from Ernst & Young. So she's able to stay on their insurance, though she's been retired for 2 years. She can stay on the insurance until she's 65 years old. At 65, they get thrown off and they have to go to Medicare. That's one type of retiree coverage. Well, then we have retiree coverage that might go for the rest of your life. You might have federal coverage, you might have TRICARE. So some of these aren't even covered in here. But if you have retiree coverage available to you, always explore what it is, how much it's going to cost you, what does the coverage look like, things like that. We typically will be working with people that don't have access to retiree coverage, or like the person I just talked about, where she gets thrown off at age 65. Well, then we need to pick it up at age 65 onward for her for Medicare coverage. However, lots of people that call us, they're turning 65 in August and they're still working at Ford Motor Company, right? So they plan to work 3 more years, for example. So if they're actively working at a large employer like that, there's nothing they have to do. They can stay on the group insurance, they can defer Medicare. As long as they're not collecting Social Security at age 65, they can even defer Part A of Medicare. They do not have to be enrolled in Part A or B. In that case, if they're, like I said, working at Ford Motor Company, let's say they're healthy, they just want to stay and work a couple more years. That's fine, okay? Then you have a situation like a small employer. Let's say they have a small employer with 8 people working at a CPA firm. That's totally different. So when you have a CPA firm like that and you have somebody turning 65, even though they have group insurance at work, they have to go get Medicare. So they have to get Part A and Part B. If they don't and they have a claim, they could have a surgery. And this happened to someone last year that we were made aware of. She had a surgery done in December. She did not file for Medicare. There were 12 people in the group. She had a massive surgery done on her back. She then got a bill in March for $80,000 because she didn't have Medicare in place. So it's on her. Unfortunately, no one's going to take that bill away. She should have had Medicare in place because Medicare would have paid 80% of that claim. Instead, she has to pay 80% of the claim. So it can happen. Just know that these stories are not meant to be horror stories other than to make you act and make sure you get your Medicare in place, because in that good situation, you got to do that. Same with Marketplace. You can't stay on Marketplace coverage. You have to get off Marketplace. Your credits, your subsidies, and everything will stop, and then you're going to roll over to Medicare. So those are automatics, okay? COBRA is an automatic too. If you're on COBRA and you're eligible for Medicare, you could be 65 plus, or maybe you're 52 and eligible for disability Medicare. That still means with COBRA, you have to have Medicare in place, because much like the small employer situation, Medicare is primary. So those are just affecting your secondary and primary payers of things. So that's like the order of payment and things. So again, I'm not getting into TRICARE, I'm not getting into federal, there's CHAMP VA, there's so many different types of coverages here that we would spend 2 hours going through that. So we're not going to, but again, our job is to go through all these kind of things and figure out what you're eligible for, but you need to know what you're eligible for too. So, if you're eligible for TRICARE for life, make sure you know that. We've come across people, believe it or not, that don't know they had it and they were actually enrolled, which is crazy. But when we get through the end of a conversation, if you need Medicare, then we're going to start going to the next steps. We're going to start the discussion of, well, okay, you need to get your Medicare set up. And that's with the government. That's not us. We are not the government. We will help you and guide you, but we're not the government. So people really misunderstand that. They think that we can process these for them. They think we're paying their premiums for them. We're not. So this is the government. You're going to go to the government. You're going to go work through Social Security Administration. You're going to go request original Medicare, which is Part A and Part B, and you're going to get those activated. Then we're going to pivot back to, that could be a long process there, and we'll kind of help through that. But then we pivot to, well, how much is Medicare going to cost? This, I will say, surprises people quite a bit. So these are the charges this year for Medicare. So if you are filing for Medicare this year, next month, whatever, 2022, what the government does is they look at your tax return from 2020. They're going to be looking for your modified adjusted gross from that year. And they're going to look to see if you were filing jointly, right here, I think you can see my cursor, or are you filing a single return? Big thing to understand here. I had someone recently say, well, we're in this category here, making $350 a year, $544 for a couple isn't bad. That's per person, okay? That is not for a couple. These are all per person rates. So you can see it goes from $170 a month all the way down to $578. So some people above $750,000 modified adjusted gross are very surprised to learn that Medicare is going to cost them as much as it does. Second thing I really want you to understand here is, let's say you are working and you are making $250,000 while you're working. Now you're retiring. You're coming out to Medicare because you're retiring. You're 68 years old. You're coming and you're telling us, well, I shouldn't be paying that much because I don't make that salary anymore. That's absolutely correct. Okay, so we'll help people. We have a form called an SS44, and I can email this to Jude after. We've got a whole template package where it has a video. There's the form attached, the instructions on how to do this. So any of you can do this. It's actually not very difficult to do. You basically come back to the table. Once the government says, hey, you're going to pay $340 per person, you're going to come back and say, well, no, I'm working with Mariner and we've got, we crafted it so I'm going to live off of $150 a year in my retirement. That's fine. You put $150,000 on that form, and then boom, the government takes you from $340 down to $170 per month. Okay, so very important to do that. If you don't do it, let's say you never heard that, you didn't know you could do this, it will roll through eventually, meaning in 2 years, they'll finally be notified that you're making $150,000 and living off of that versus $350 or $250. It'll come down, but don't wait. Why wait when you have 2 years worth of savings you can get here, okay? If this, a lot of times at webinars, I get the question of, well, I didn't know that and this happened 8 months ago. Can I still be requested to go down? Do that, yes, because I've seen them go back retroactively, even 6 months in terms of giving you the premium back. So definitely do that. Okay, so this is always surprising to people too. So there is these are surcharges, right? These are just surcharges. Taxes, if you will, on higher net worth or higher income, I should say, not net worth, but income people. So in this case, there's actually another charge that is kind of connected to the Part D, the drug plan side of things. This confuses everybody. One of our clients yesterday left a voicemail. He's like, hey, I don't know why I'm paying $32 a month to the government. I understand why my Part B got higher, but I don't understand why I'm paying them for another drug plan. I already bought one through you guys. That's not what he's buying. He did buy a drug plan through us, but he's paying this $32 over here for nothing, for absolutely nothing, other than it's a tax, okay? So just know that it's gonna hit you on both sides, and that's where, when I say the top tier people, they're paying $77.90 per month for nothing, plus the $578 they're already incurring. So then they're not even done with supplements and such. So it gets a lot pricier than people think. So this slide here just is interesting in terms of how many people are actually being hit with those high surcharges. So 5.9 million people this year, but if you look down to 2029, they project that to be 10 million. So a lot more people are going to pay a lot more. So these brackets have been shifting over the years. They reduce brackets to catch more money, basically. So just know that that's there, and then, you know, prepare yourself with your planning. Even if you're 63 or 64 right now, this is going to come, you know, to you at some point. When somebody, again, continuing along the path of, hey, I need to enroll in Medicare, then we got to get them enrolled. So this is the enrollment windows. There is something called an initial enrollment period, IEP we call it. Everybody kind of seems to know this. It's 3 months before, 3 months after your birth month, and then including your birth month. So for some reason, everybody knows this rule. It's kind of funny, but it only happens one time. So where people get this wrong is if you're 65, this is going to hit you one time, and you have 7-month window here. If you need Medicare, go get it. That's all they're saying. That's it. If you go through this, doesn't matter. If you have insurance, if you've got insurance elsewhere, you can blow through this and it's not a problem, okay? But this only happens one time. Another thing I'll just point out, that a lot of people think that you have to notify the government just to tell them you don't want Medicare. So that's not true. If you're not collecting Social Security, you're not going to be enrolled automatically, but you also don't have to alert them to the fact that you don't want Medicare or don't need it, okay? So just that's I don't know where that comes from, but everyone thinks they kind of have to tell them, and they don't. Now, if you've gone through that initial window, you didn't get Medicare because you've been working at Ford Motor Company. So again, back to my Ford guy, now he's 67. So now he's ready to retire. So what they do in this case is actually pretty logical, I think. They come to us 2 to 3 months ahead of time. We get an email, hey, I'm going to retire. What do I have to do now? So in this case, we send them another tutorial and the form and everything that goes with it. And this is called giving them the employer verification form. So we give them, it's an L564. So what that is, that form is super, super important for people that are working. So now you're 67, you're going to take that form back to Ford Motor Company's HR department. You're going to give that to them. They're going to sign off. They're going to basically sign off that Jim Smith has had coverage with Ford since he was 65 years old. That's why he didn't need Part B of Medicare. So then all we have to do with Mr. Smith is find out, well, when's your coverage ending at Ford? He says August 31st. Okay. So we're working on September 1st. So all we have to do is he needs to get his Medicare started for September 1, and then we have to put his other plans in place for September 1, okay? That is exactly why there is no penalty. And this is exactly why right here that Costco piece is so wrong, right? Because it said that he had to get Medicare when he was 65. It's not true, all right? He's not getting a penalty. And it implied, and it actually said, you will get a penalty for the rest of your life. It's not gonna happen. So we do this all the time. I want to just bring up HSAs with health savings accounts. We get this question a lot. So I had a webinar at 12 o'clock today. Most of the questions were around HSAs, which is kind of crazy. But HSAs, when you enroll in either A or B, or you are enrolled in A or B, let's say you're taking Social Security at 63 years old, you're automatically going to get enrolled in at least Part A of Medicare. You can't get rid of that without paying back all your benefits. But you are contributing to an HSA. And an HSA, let me clarify too, is the health savings account. It's a tax advantage account. You put money in there. You can spend it on medical expenses. It's a great account. I love mine. A lot of people like them. A lot of people fund them. When you enroll in either part of Medicare, Part A or Part B, you can no longer put money into your account, into your HSA account. So this confuses many people. One of the questions we had earlier was, when you're turning 65, if you are turning 65, you can fund all the way through the month prior to your turning 65. So I'll be clear. So let's say you're a June birthday and you're funding your HSA and you want to put as much as you can into it. You can take January, February, March, April, May, and prorate the amount. That's how much you can put into the HSA this year. As of June 1st, you stop because you're turning 65, and in this case, you're going to get Medicare, okay? If you don't have Medicare, you have no A, no B, and then you're now 67. This happened a couple years last year to one of our clients. He was 67 years old. I think he was 67, but he did this. This was him. He applied. He did not have A and B. He wanted to fund his HSA as much as possible. So he did it perfectly. He applied for Medicare in May. And then what happens with Medicare, this is where it gets very confusing. They roll it back 6 months and they start his Part A coverage November 2020. So we told him, stop funding your HSA in October of 2020, and he did, and he was fine. But this is technically how things are supposed to go. Okay, I know not everybody gets, the chance to plan it as much, but this is technically how it's supposed to work with Medicare. It's just a dumb rule that it starts 6 months prior to. But then I usually get the question of like, well, wait, do I have to stop funding 6 months before I turn 65 and go on Medicare? No, you can fund all the way through till your 65th birth month starts. So again, there's questions, we can answer those at the end. It's just really kind of confusing. So all of that stuff that I just went through, that's all government or tax, and the HSA is tax related, but it's government stuff. All right. So prior to this point, you can see why people think I work for the government or we work, as part of the government. We're not. But this is the point where we become Medicare agents, if you will. I like the Medicare New Handbook here because very simply, it's trying to describe your two options. So just remember, when you get to Medicare and you have to make a choice for coverage, you do have two choices. And again, just ignore people that have retiree coverage or TRICARE or federal insurance, things like that. This situation I'm talking to right now are people that you have to go buy your coverage yourself. Next step, okay? You don't have access to anything else. So you have two choices. One choice is right here, again, from the handbook. You have original Medicare, which remember is Part A and Part B. Then we, as agents, give you a Medigap contract, which is also a supplemental plan. And all it does is follow original Medicare. So it's actually very simple. So because you have original Medicare, that is your network. And that's one of the nice and convenient things about original Medicare is the whole country is your network. The only thing you need to do is ask a doctor's office or a hospital or anybody is, do you take original Medicare? If they take original Medicare, they take your supplement. It doesn't matter who your supplement is through. Doesn't matter at all, okay? You can travel very freely with this. You can go anywhere you want. You do not need referrals, no prior authorization, no nothing. It's really easy. You do get a Part D plan. It says you can because it is technically optional. We tell people absolutely, you got to get a Part D plan. That's their package, okay? So it's very simple. Medicare Advantage over here on the right-hand side, this is option number 2. This is another choice you have. This is also called Part C sometimes from the government. It's kind of how they market it. And what this does is it's a bundled all-in-one alternative to original Medicare. So what that means is they're just taking your Part A and your Part B services and they're packaging it. They're usually putting dental, vision, your drug plan, everything's kind of packaged together in one, managed care situation from an insurance company. Because it's a managed care program, you're going to have networks, you're going to have potential restrictions and things like that. So there's convenience sometimes in the packaging, but there might be inconvenience in terms of, do you have to get prior authorization, things like that. Now something here, and I'm going to go through a next example where it kind of can make a little more sense to you. Medigap. So again, this is a supplement way, and I'll talk about the Medicare Advantage in a second, but with a Medigap plan, if you are new to Medicare this year and you want the most comprehensive package coverage you can get for your body, it's Plan G as in girl. It just is. So Plan G, and I'm going to use a Michigan rate. Everyone's all over the place, but Michigan for a Plan G female is about $125 a month. So she is going to pay that flat fee, $125 every single month. It doesn't matter if she doesn't go to the doctors for 3 months, she's going to pay it just like your insurance typically is, right? You pay your car insurance, you pay it every month, regardless of whether you're crashing your car, right? So this is how that works. She's going to have that deductible of $233. Now remember that was the Part B deductible. Once she satisfies the deductible at $233, she can do anything. She has 0 copays for anything. She can be hospitalized, for 10 nights. There's no cost. Chemo, radiation, if she got ill with cancer, she has no cost, no copays, no coinsurance. She can stay in skilled nursing facilities for up to 100 days free. Physical therapy, you can go in 20 times if you had a knee replacement, 0. So all those charges are zeros, and that's what you're paying for, okay? You pay that $125 to get all that included. If you don't go in, you don't get your money back, but you just didn't go in that month. You're not going to get dental, you're not going to get vision, and then you do have to add that extra drug plan. So remember that's separate, okay? Flip side, Medicare Advantage. Now what I need you to understand here is look at the very, very, very bottom where it says plus your Part B premium. Just know that whatever path you pick here, you will be paying your Part B premium to the government. Okay, a lot of people think that if you go Medicare Advantage, you have zero cost across the board for anything. Okay, people on Social Security, they don't pay attention that the Part B premium is coming out of their check, so they think they pay nothing. That's not true. The only people out there, if anyone is on Medicaid that is listening, Medicaid and Medicare recipients, if you're in both programs together, those are the only people that would be paying nothing. All right, but every single other person is going to pay at least the $170 per month. But Medicare Advantage, you can add that. So you start with your $170, but you can add a Medicare Advantage plan to your world and you will have zero premium. There's lots of them for zero premium. Some have more premiums for sure, but you can get a lot of plans for zero, absolutely zero. They also, many of them don't have a deductible. They all have a legal maximum out of pocket. So again, that person that I talked about, the knee replacement for $12,000, she would have been better off with a Medicare Advantage plan because at least she would have capped her financial exposure up to $7,550. So these ones are, Medicare Advantage is more like your coverage that you're used to, more like your group insurance, your individual coverage, because you're used to paying maybe $40 when you go to the doctor, right? Hospitalization, you usually expect to get a bill. So this is what happens with Medicare Advantage. You get a bill for $300 a night for being hospitalized, right? Chemo, if you have chemo radiation with a Medicare Advantage plan, those are big charges and you might hit your max out of pocket that year if that happens to you. Skilled nursing, though, you'll get 20 days of coverage up front, but the rest of them you're going to have $200 copays. So things like that. Physical therapy is one that people don't really pay attention to until they need it. And all of a sudden, they have $400 that month in PT charges. So they are very different than one another. Medigap is completely different than Medicare Advantage. Medicare Advantage is going to typically, like I said, include dental. If you're going to go the Medicare Advantage route, I would pretty well always suggest upgrading the dental because you can really get some significant coverage for root canals and crowns and things like that. They'll also throw in some vision, and then very often they put in drug plan premium, but don't misread that because some people, I had a guy last year, he was going to sign up for Medicare Advantage because he said, well, my Xarelto is free if I do that. It's not free. He misread that. It's really a $42 copay, but he thought it meant free drugs, okay? So Medicare Advantage is never going to give you all the free stuff that you think of that is on TV and kind of insinuated that you're gonna get, so just be careful. The reason why we really, really harp on understanding what you're buying here is because of this right here. This is called the Medigap Open Enrollment Period of Time. So to me, I consider this the gotcha moment to Medicare. So people that are very healthy at age 65, they're, I will tell you, the toughest people to counsel with this stuff because they feel invincible to some degree, or you've had good health and you think it maybe is going to stay that way. In my seat where I sit every day, we have lots of people that start out like that and 6 months later, 2 years later, things change. So what happens is we don't want you assuming if you take Medicare Advantage for free, it might work out great for a couple of years, but it seems like we're always getting that phone call, especially in the fall, where everybody thinks you can do whatever you want with your plan. They call us and they say, hey, I called Medicare and I got a plan and it's an Aetna PPO and it's worked pretty well. But now, I'm starting to get more testing and I just had a stent put in and I kind of want to up my coverage and get that Medigap stuff I remember hearing about. You're medically underwritten at that point. So that's where we as agents have to turn around and say, well, let's talk about your health. And all of a sudden you can't qualify. So for the first 6 months when and this is really, really important to understand, when you are 65 or older, not 65, but 65 or older, and it's your first time enrolling into Part B of Medicare. That might happen at age 65. It might happen at age 67, 72, whatever. We've got somebody recently 77 years old, first time in Medicare ever. So when they're first enrolling, this is when you guys get a free 6-month window to get any Medigap plan out there with no regard to health condition. So my disability guy today, he has lymphoma. So he's very worried about this 6-month window. When he turns 65, he gets a do-over. So I said, it's no problem. We're going to do one thing now, but when you're 65, we're going to flip you over to this Medigap plan during the 6-month open enrollment window. Excuse me. So it's super important to understand that it exists. You may never need to take advantage of it. Hopefully you don't, but it's super important for people that are ill. So again, just remember that you're going to have medical underwriting if you don't understand that this can happen. And there's no guarantee. So a lot of people do get approved, but a lot of people don't. We can't guarantee when you're going to be able to get approved or not. Excuse me. And then there's also different times a year. So if you're going to take that strategy and plan, you got to kind of have to plan by the end of the year. In the fall is the only time you can apply for a Medigap plan to get out of the Medicare Advantage. So it's just dicey because you don't know when. You know, I think of it as like musical chairs. You don't know where you're going to be sitting, which kind of policy when the music kind of stops with your health. So just be really careful of that. Excuse me. So we really, really encourage you all to really start thinking of yourself, you know, what kind of plan do you want when you're 75? What kind of plan do you want when you're 85? Because it creeps up, as we all know, but it's very, you can't change some of these mistakes. Like I said, we can't, when we have someone calling that, you know, mom is 88 in a skilled nursing and the coverage is not good, there's nothing we can do. Okay. So, you know, be proactive in your thinking on this kind of stuff. Here's a good, I know this is being recorded, but some people like to take a snapshot of this screen. It's a good overview of Medigap versus Medicare Advantage, talking about networks, you know, again, just to hit the highlights. Medigap, complete freedom. You can go to MD Anderson. You can go live in Florida for 3 months for snowbirds, everything like that. Higher monthly premium, absolutely, is higher than zero. You're not going to get the extra benefits, though some carriers are putting gym memberships, like I said, and some, you know, routine things in. Prior authorization, very rarely will that occur with original Medicare. Referrals, you don't need any referral. You want to go to a dermatologist in Texas, you just go. You do have to buy your prescription coverage, you know. And then Medicare Advantage, again, you're going to typically have an HMO or PPO. We want you to stay in network for the best pricing. You can have lower monthly premiums. That doesn't mean cost. It just means lower monthly premiums necessarily. Okay. But there's lots of extra benefits. The insurance companies know what you want. They know you want dental. They know you want gym memberships and everything. So they package it like that. Okay. Now, if you're in Medicare Advantage plan, the longer you're in it, the chances are you're going to deal with prior authorization at some point. If you don't like that, your personality type is really having a problem with that, maybe that's not the plan for you. Referrals are not super common like they used to be, but they might be required. Prescription drug coverage, that is typically included. All right. So almost every single plan out there, you can buy a Medicare Advantage plan, or you can buy what we call MAPD, Medicare Advantage prescription drug. So most people are buying the whole bundled, the entire thing with the drug coverage built in too. So these are just kind of positives and things we're constantly hearing about Medigap, right? It's control. If you are a business owner or somebody that just really controlled everything for 40, 50 years, most people don't want to give up control of their healthcare. They don't understand that they can buy Medigap and retain the control too. Budgeting is great, especially if you're ill. There's nothing better than, you know, people with Parkinson's, whatever, they just, you know, for that flat 120, 130 a month that you're getting what you're getting. There's just nothing like it. Snowbirds, like I mentioned, we have people, we're in Michigan, so lots of people are in Florida for 4 or 5 months. You can go anywhere you want. But you have to be okay with the higher monthly premiums. So that is really what it comes down to. And I will tell you, I kind of liken it to like, there is no trick to this kind of stuff. Every single person listening, and I know what everyone wants. You all want Medigap. Every single one of you want Medigap. They don't want to pay more than $0 every month for it. And they want it to include dental. So I know that sounds really kind of silly on the surface, but it's true. It's what everybody wants. We just tell people over and over, you just can't have that. You have to pick one of the two. You're going to sacrifice something. In this case, Medicare Advantage, you've got affordability. I mean, there's nothing better than $0, right? Under 65 years old on disability, these are people like my disability case just a couple hours ago. We're going to do Medicare Advantage for the first year. And then when he turns 65 next year, we will give him a Medigap contract, because under 65, they penalize him. They'll charge him $500 and $600 a month if he purchases Medigap. So they can do that. So it doesn't make any sense. You just have to catch them when they turn 65. We've got people too that are great and they're okay with networks. I have an 80-year-old that lives on a farm in Michigan. He doesn't want to pay a dime. He doesn't go to the doctors very much. He has the $5,000 for his max out of pocket. I'm not worried about that. He never leaves his farm. That's fine. Totally. It's a great plan. He's been at it for years and he's thrilled. Okay. Then you have veterans. So veterans are a great group that are really good for Medicare Advantage. Now they can also get Medigap, but it's a really nice fit with a Medicare Advantage plan. So veterans technically don't have to go get Part B. They can just stay in the veteran system. They can rely on the VA facilities. They don't have to get Part B. Always should get Part B, and even the VA recommends that they do get Part B coverage. If they do, then what we normally will do is give them a Medicare Advantage plan. There's no reason not to give them a free plan, give them some extra dental. That way it creates a whole new network for them for services. So some people have VA access, they never use it. Some use it 100%. Some might use it 80%. Well, then they have to have a plan to be able to come out of the VA system because they are totally independent systems. The veteran system and Medicare do not talk. They are two different items. So therefore, if you've got somebody that goes to the VA, maybe they have an accident and they're not near a VA hospital. So at least if they have a Medicare Advantage plan, they can go and take advantage of the outside facilities, civilian world. Same thing with, second opinions, all that kind of stuff. So these are really, really a good fit, definitely for Medicare Advantage plans. Now, kind of moving over to the drug plan side of things, this is called the donut hole. If you've ever heard of somebody complaining about their drug pricing or talking about the donut hole, this is what it is. It's a pricing mechanism that goes into the Part D plans. You have 4 stages. We're not going to dive too much into this. I will just say a couple of things about the donut hole. If you are experiencing the donut hole, you're paying a lot of money for medications for the year, for prescriptions. They're very expensive. If you are just taking one drug, let's say you're taking a atorvastatin or a couple tier 1s and they're cheap, do not spend 1 minute worrying about the donut hole. We get lots of people that come in. What is the donut hole? They're paranoid. They either take nothing or $1, $2 medication. Donut hole means you're really struggling with high price medications. So very confusing how they price it, but just know it means they're paying a lot of money. Here's some important things with Part D though. Absolutely get a Part D plan. Every single person, if you get a Medigap plan, make sure, even if you don't take any medications, that you're getting a Part D drug plan. Always, always, always. You'll be penalized if you don't get a plan, okay? That's part of the reason to go get one, of course, but it makes a lot of sense if you don't take any meds. Why would I need a drug plan, right? Well, make sure you do because you're gonna get a penalty. And number 2, the worst part sometimes is, what if you're diagnosed with something in 3 or 4 months or just put on Eliquis or Xarelto or something like that, you don't have a drug plan. And I can tell you from somebody yesterday, one of our clients let his drug plan lapse. It lapsed months ago. He had to go into the pharmacy and buy Xarelto for $500 instead of $40 copay. Okay, so big, giant mistake. And then here's the key in his situation. I can't give him a drug plan. We can't give him a drug plan until next fall, and he can't start that till January 1st of next year. He's going to pay out of pocket Xarelto the entire calendar year until January 1st, 2023. So very expensive mistake. He just screwed up and didn't pay attention to his bills. So if you are on Medicare and you already have this and you know about Part D plans, make sure you're checking your plan annually because they change them all the time. In September, the carriers legally have to tell you in September what changes have been made to these plans. It comes to your mailbox. You got to look at those things because they do switch them up. Premiums can change, the coverage can change. A lot of people aren't paying attention. So, only 10% of people are actually changing those plans. So make sure you're watching that. Here's some resources that we kind of give out for prescriptions because they are very tough to deal with sometimes. I ran a plan the other day and it was $28,000 for a person. It's absurd what they're allowed to charge. And maybe you don't know this, but Medicare is not allowed to negotiate with the pharmaceutical companies. So there is no negotiation. Whatever the pharmaceutical decides to charge, that's what they can charge Medicare. It's horrible. It's wrong in my opinion, but we have to deal with what we have. These are some places that people can go to for some help. Always look at GoodRx first. Even with just simple creams or drops or your pet's medications. I used it for my dog a few years ago for some antibiotic he had to be on. But GoodRx, you can use it on your phone, your computer. Just understand though too, if you use GoodRx now has kind of sold out and they're selling your data. So if you use it and give them your name, address, phone number, you're now in the system for a call center to call you. So just beware. I'm not saying don't use it because of that, because we use it, my husband uses it, but it's just a pain. There's costplusdrugs.com. That's Mark Cuban's new company. And that's been interesting to watch because as he introduces more drugs that competes with GoodRx, we're seeing the GoodRx pricing actually drop, which has been really kind of exciting. Then there's a couple other places called Simple Fill, Needy Meds. Those are kind of brokers for people that take high price like a Humira or Otezla or expensive medications. What they're trying to do is introduce you to manufacturers to kind of get some assistance in place. But talk to your doctors, see if there's different drugs to take. There's so many different things with drugs that this could be an all day kind of thing too. There's international. And then if you have low income, maybe you can be eligible for a subsidy from the government, but Part D gives everybody a big headache, kind of along with dental and stuff like that. Now here's the timing of everything that we're doing. So January, February, March, you can see today is the very, very last day of trying to get people that want to leave a Medicare Advantage plan over into a Medigap contract if they qualify. I have one person right now, and we are down to the wire. I don't know if she's going to get approved. We started 12 days ago, and this is just an example of the stress, you know, you have to go through. She wants to get a Medigap plan like her husband has, but we don't have an approval, and it's pushing 5 o'clock on, you know, the 31st. So if we don't get an approval by tonight at midnight, she's not getting that plan until we have to try again in the fall. So that's what we're doing now. October 15th to December 7th, that's that window where drug plans, or you can change Medicare Advantage plans if you didn't like yours, or maybe your doctor stopped taking it, things like that. Drug plans will start up again for the new year. Medigap people, if you have a Medigap contract, and let's say you have an older plan F, I didn't even talk about plan F or plan C, but if you have an older plan, maybe it's $200 a month, and you know that you could go to a different carrier for $140 a month. That would be worth changing. If you're healthy enough, then for sure change, but you can do that any month of the year. Okay, so just know that you can do that all the time. Everybody thinks that every single thing with Medicare has to be done in the fall, and that's not true. The other thing related to that, which is kind of funny, is a lot of you think that you have to only retire in the fall because they think it's the only time you can buy Medicare products. So if you're working with your advisor at Mariner, don't think you have to hold out till October 15th to retire. You can retire anytime you want. Summertime, that's what we do all year long. So people, you know, kind of say, well, what do you do the rest of the year? It's like crazy. People have birthdays all year and they retire all year. So it's kind of nutty. So when we're talking, I get this question a lot, when do I start talking about Medicare? Well, with us, 64 and a half, it's just to alleviate you screwing up and just doing something wrong, right? If you're doing the HSA, or you should do this or shouldn't do that. We have a lot of people we talk to that we might not help them for 3 or 4 years, but it's a whole pivoting conversation of like, well, I'm doing this, this, and this, and this. What do I do? We give them our 2 cents, and then we put them in our system, and in 3 years, we might write them a policy. But when you're talking to your Mariner advisor, sometimes these conversations too about, you know, the surcharges, they should happen earlier too, like Roth conversions. Think of the things that you're doing with your advisor. Roth conversions, you have to time those so that you're not impacting your income. So these you might start with them 62 or 63 years old. I will tell you that 62, 63, 60, all those ages, way too early to talk to us, really. Know some of the basics, you know, get the charts out, know that you're going to have income brackets and such, but it's too far out for us, okay? We just want to help you when you get on the doorstep so you don't make any mistakes. Here's the YouTube channel that I talked about. I will say Medicare Advantage versus Medigap. We did a survey last year, 62% of our people, they're pretty educated, but they said that was the confusing thing for them was deciding between Medigap and Medicare Advantage. It is a big decision. We did a really big webinar in January that Cameron, my son here, who runs the YouTube, he cut it down to 16 minutes. Super helpful. It's been super popular. It's on YouTube. It gives you the ability to stop, rewind, you know, ask questions or write down questions, call people, that kind of stuff. But we have a topic, you know, everything is pretty much on here. How to go online and do this, you know, Medicare, here's plan F, plan C, supplements, explain all that kind of stuff. It gradually gets all rehashed and redone too. It's just, you know, a lot of work to do. We also do podcasting. So we've got episodes that are 30 to 40 minutes about, you know, we just did one, same thing on Medicare Advantage. There's one coming out next Monday, all about, I think it's all about Medigap. So we did one, we recorded on just Medigap. So people had asked us to split it out. Like, can you do one on Medigap and one on Medicare Advantage? So you can see how much goes into it. If we can talk 45 minutes just on Medigap, you can see why in an hour Medicare, a webinar, we can't just cover everything. So there's a lot to this. Our website is how people, you know, we get phone calls scheduled. That's how people, when I say they're on my calendar, this is what happens. We've got agents, and you just, you know, if you decide to call us, just be careful that you're just you're pick an agent that is licensed in your state. We are not licensed in every state. I'm going to kind of put this up here last. On the very bottom is the ones we are, you know, the dozen states that we really want to be focusing on. We do have referral sources probably at every state or pretty close to every state, so we can help. And then I even have some licenses. I probably have 40, but it's very difficult to write in every single state and know things really well. If we don't know our limitations, we're going to tell you that and kind of refer you if you'd like the referral. But you can email any questions you have to myself at info@Medicare team. I answer those. And there's our website, there's our phone number. And if you guys do have any couple questions, I know we got it right to almost 5 o'clock.
Yep. Yeah, definitely. We did have a few questions that came in, and also just so everybody knows, I am going to shoot over a resource page from Joanne's team into the chat box there. So definitely feel free to jump into that chat and grab that link, and that'll direct you over to Joanne's website. All right, so we have a few questions here. I will just go ahead and jump in. So if you're Medicare eligible but still have coverage with a large employer, we know that you can postpone Part B, but should you sign up for Medicare A?
Yes, sign up for Part A, and then don't forget, if it's a large employer, you said it is, sign up for Part A. It'll just coordinate. It'll give you some free medical hospital coverage. It'll coordinate with your group insurance. However, if you're funding the HSA and you want to keep doing that, then do not sign up for Part A.
Perfect, thank you. Now, do you have to register at 65 even though you don't use it at 65? And this one came with a little comment. Everyone says that you have to pay a penalty. You have to pay or pay a penalty for forever.
I know, isn't that the funniest thing? It's just everybody's, it is. I just don't know where that comes from. But no, you don't even have to register at 65. Like I said, if you're collecting Social Security, then you're in the system. They know you exist and they're going to give you Medicare A and B right then and there when you turn 65. You don't have to keep it. If you have coverage elsewhere, and that the whole key is if you have coverage elsewhere, the government's not going to make you all buy double coverage. They're really not. So you want to find out if you need it. But no, not everybody has to take it or use it or need it or pay for it.
Perfect, thank you. Now, this is a question about part-time work. So if somebody's fully retired from their primary job at 65 and then they apply for Medicare, then they pick up some part-time work starting at 65 and want to continue to work for many years. Does that income from the part-time work affect the Medicare status?
Yep, it's going to be income, just like everything. Just about everything is modified adjusted gross, picks up just about everything. Municipal bond interest, really, it definitely picks up everything. So yes, you would just kind of keep your benefits and pay for your insurance, but your income is going to definitely factor in.
All right, we'll try to get in like one or two more questions here. So if someone is financially able to retire early, so given the 2-year look back on income, does it make sense to retire at 62 to ensure the lower premiums?
I would say no, just because you can always, even if you're making a big income of $500,000, as long as that's gone, you just file that SS-44 form and then they reduce it. So, I wouldn't try and retire early just to be in the lower category, because you can spin it on a dime and get it reduced. So I don't think you need to do that.
Perfect. And then since we only have 1 more minute left, let's go ahead and just answer one more question here. So somebody has a spouse that is turning 65 at the end of the year, receiving Social Security benefit. They are currently employed at 63, intending to retire in April prior to age 65 and using COBRA to cover until they turn 65. The spouse has to sign up for Medicare this year, and then when they retire and go on COBRA, they will need full Medicare for the spouse's insurance.
If I followed that right, this one spouse is turning 65, the next spouse is going to retire next spring and take COBRA because he's 60, he or she is 63. That would be normal. Then the person, the older one, the 65-year-old, because they're Medicare eligible at that point, you definitely want to probably jump off. You don't want to take COBRA. You either want to keep COBRA and get A and B. Well, they would have A and B, but I would jump off and go to independent Medicare. Sometimes you have a rare case where someone's taking really high price medications and you want to keep COBRA for 18 months, but that would be really, you'd have to dive into more than this, surface question. But I'm going to say that person would just jump off and go off to Medicare.
Perfect. Awesome. Thank you so much. So that's
There's a lot here. Yeah. And I was going to say, Jude, if you want to, the last webinar I did, if they sent me these questions, I'm happy just to poke the answers back in an email and you guys can do what you want with them.
Okay, perfect. Yeah, we have all of the questions that everybody had asked. We'll definitely make sure that we're sending this out to everybody that attended here with all the resources available with the slide deck as well. But lastly, Joanne, we just want to thank you for your time today. This has been really, really awesome. I can tell even just from the questions and the comments that we've gotten that everybody's received a lot of really great information. As of myself, I know that I've learned a lot here as well. So thank you. I appreciate it. And thank you everybody for joining. Awesome. Have a great day, everybody.